are a number of degenerative conditions, which by definition means they continue to get worse, not better. Bone density, a prime example. Treatments can temporarily relieve the pain, but at the same time make the condition worse. So my guest today has a better solution for long-term relief, and that's Dr. Buzz of Buckeye Physical Medicine and Rehab. Good to see you, Dr. Buzz.
Hey, Robin, how you doing today?
I'm doing great. We are talking about degenerative disorders today, if I can say that correctly. So what are the most common? What things are people suffering from?
Degenerative conditions that we typically see at Buckeye Physical Medicine and Rehab are degenerative knee conditions, hip conditions, shoulder conditions. And something that's important for the viewers to realize is if you have a degenerative condition, you only have a few different options. Option one is you can do nothing about it.
Sure.
But obviously, if you do nothing about it, it's going to get worse with time. So that's really not a viable option. A second option that we see often in Buckeye is people will be getting cortisone injections. I like to call that old-fashioned medicine because cortisone has been around forever, but it's really not safe and effective. It's a great painkiller, but we know from the research that every time you get a cortisone injection, you have up to 8% bone loss. So it really destroys the joint. So if you're doing cortisone injections listening to this, it's not if, it's when you're going to have either surgery or joint replacement. So that's like old-fashioned medicine. You could have surgery, right?
Right.
And surgery sometimes is necessary, but there's always risk and complications in rehab afterwards. And that's why we're really excited at Buckeye to offer regenerative medicine to Columbus.
And I think that's a big deal, too, because people out there who probably are getting cortisone shots are doing that to delay surgery, right? They think that this is going to help them not have to have surgery as soon. But you're right, it's damaging in the meantime.
Correct.
So this is another option that doesn't cause that, right?
Correct. Regenerative medicine has been around since the 1970s. It's been more prevalent in Europe, and things always come from the West Coast to the East Coast in the United States. So it's been in California and stuff for some time. But a lot of pro athletes are using it at this point. The NBA playoffs this year, Steph Curry had it, Tiger Woods, Alex Rodriguez, Kobe Bryant. These are something that all of the athletes are using, so why not make it available for the public?
Okay, and it's called, one of these options, PRP, platelet-rich plasma. So
Correct.
How does this actually work?
So platelet-rich plasma is an excellent option for people that are 40 and younger. And basically what you do is you come into the office if you have degenerative joint disease, chronic tendinopathies or tendinosis. You basically come in and we draw your blood in the office, your own blood, and we spin it down and we basically capture all the growth factors from your blood. And those growth factors, we inject it back into the injured area. And what that does is it allows your body to recruit stem cells that are circulating in your own blood to heal the joint. So it's like supercharged healing. It's pretty cool.
That sounds very interesting. And there's different types of treatments, too, for people who need additional stem cells, somebody who may have a problem beyond that, right?
Yeah, so as we get older, we have less circulating stem cells. So if you take an infant, has 1 in every 10,000 cells in their body is a stem cell. And just to clarify, stem cells are the cells in your body that will differentiate into anything and heal. If you get a cut, stem cells heal it, a bruise. Joint damage, that's what heals these things. So, but as you get older, when you go from an infant to a teenager, it's 1 in 100,000. And I'm 46, so I'm probably 1 in every 300,000 or 400,000. So we say right around that 40 years of age, if you have, bone-on-bone knee, bone-on-bone hip, we'll want more stem cells than you have circulating, and there's a couple different options for that.
Okay, so yeah, what are those?
So the different options are, you could use bone marrow, or you can use adipose, where basically we can either harvest bone marrow from your hip, which we don't do at Buckeye, just because that's kind of an invasive and that's more of an old-fashioned procedure.
Sure.
A newer procedure is what we do is we can take your adipose or your fat, because your own body fat has lots of stem cells. So we basically, do like a liposuction, take fat out of an area, and we mix it with your own PRP, which are those growth factors, and inject it back into the injured area. That way you have those extra stem cells necessary to heal it.
So what kinds of results are people seeing? What are some of the responses you get after people have this done?
Amazing. I mean, we have multiple people that are scheduled for surgery, knee replacement, hip replacement, and they're fixed. It literally regrows the cartilage, regrows the ligaments and tendons in that area. If you see the x-rays pre and post, it's just a miracle. I
was going to say, and are all of these safe? Because people might sit there and say, I'm not familiar with this, what's going on? So is this safe and effective?
And it's a simple injection. I mean, you come in, it's a little teeny needle, and they put it into the joint. Most people don't even feel it. So it's very safe and very effective.
So to see if they qualify, they just have to come in, meet with somebody from your staff, right? Easy as that.
Yeah, they'd come in and meet one of our medical providers at Buckeye Physical Medicine and Rehab, and just look at the area, look at the joint. Now, obviously, if someone has a completely ruptured ACL, it's not going to go and reattach a ligament. But if you're suffering with bone-on-bone or degenerative joint disease, this thing is a miracle.
Okay, Dr. Buzz, thanks as always for being here.
Thanks, Robin.